Afternoon. Today we will be discussing maternal and child health, wherein we will to discuss the health of mother and child because healthy children need healthy mothers to produce a healthy society. So remember our sustainable development goals and remember that one of the strategies for good health and well-being and for our SDGs with taking care of our mother and reducing maternal mortality and our child by reducing child-infant mortality. Again, we go back to the definition of health, which is a complete physical, mental, and social well-being state and not merely the absence of disease. These conform the totality in health, although there are differences between ages, countries, cultures, classes, and gender that prevent a homogeneous consensus. So physical and mental health and well-being, social health, cannot exist independently and it belongs to interdependent dimensions. Hence the SDGs which involve economics, climate, financial, etc. And health and disease exist simultaneously and are mutually exclusive only if the health is defined restrictively. Health and disease are determined by many factors that interact in social, psychological, and biological form. Hence, remember your first year lectures of biopsychosocial aspects of illness. Those that worldwide are associated with indicators of poverty and low levels of education. So individual health is affected by individual factors, social interaction, cultural structures, and value society resources. Economic levels and health services efficacy and effectiveness have direct implications in the individual, familiar, and community's health from the local to the global setting. Again, we define public health. So like science and art, public health is to promote health, prevent diseases, and to prolong the life through organized efforts of the society. The gains in health have been obtained as a result of improvements in the economic income, education, water provision, nutrition, hygiene, health services, and the result of new knowledge on the causes, prevention, and treatment of diseases. So, on maternal and child health, monitoring, investigation, and control of risk and damages, armed with health promotion, social participation and empowerment, policy making and capacity management, and evaluation and promotion of the equitable access to the services, and improvement of quality of health services, researching and development, impact reduction of emergencies and disasters, and population health monitoring and analysis all play a role in maternal and child health. So it's important to know demographic changes, epidemiology, environment, and how they relate to chronic diseases, your sanitation, leading to problems of public health. And this would lead to certain morbidities and mortalities, your emergent and re-emergent diseases and health inequities affecting reproductive health. So maternal and child health as a risk factor would lead to morbidity and mortality given this concept map. And it's a local and global health problem. So what are the public health challenges? So actual sanitary challenges requires to implement new strategies of public health that prevent the disease's appearance and promote total development of health. These challenges exist due to the priority of diseases treatment services, buy-on promotion programs, and primary prevention of diseases. Reproductive health addresses the reproductive processes, functions, and system at all stages of life. So this implies that people are able to have a responsible, satisfying, and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do. It is the right to be informed of and to have access to safe, effective, affordable, and acceptable methods of fertility regulation of their choice. So the right of access of women to appropriate healthcare services to go safely through pregnancy and childbirth and provide couples with the best chance of having a healthy infant. So remember your social determinants of health, the providing of health services, genetics factor, health promotion and prevention of reproductive health, which would bring us to maternal and child health and eventually its morbidity and mortality. So maternal health is health of women during pregnancy, childbirth, and the postpartum period. Motherhood for too many women is associated with suffering, ill health, and death. Maternal mortality remains high and sometimes unavoidable due to still hemorrhage, infection, high blood pressure, unsafe abortion, and obstructed labor are major direct causes of maternal morbidity and mortality. And maternal health care is a concept that encompasses family planning, preconception, prenatal, and postnatal care. So what are the goals of preception care? This includes education, health promotion, screening and interventions for women to reduce risk factors that might affect future pregnancies. So prenatal care is important because this is a comprehensive care that women receive and provide for themselves throughout their pregnancy. And women who begin prenatal care early in their pregnancies have better birth outcomes than women who receive little or no care during their pregnancies. This is seen in the current pandemic, wherein there are a lot of problematic deliveries such as preterm labor, etc., and abortions because of the lack of prenatal care. Postnatal care, on the other hand, includes recovery from childbirth, concerns about newborn care, nutrition, breastfeeding, and family planning. Time just after delivery is especially critical for newborns and mothers, especially during the first 24 hours. Two-thirds of all maternal deaths occur in the postnatal period. So most women do not have a good access to the healthcare and sexual health education services in developing countries. So for example, a woman in sub-Saharan Africa has a 1 in 16 chance of dying in pregnancy or childbirth, compared to 1 in 4,000 risk in a developing country, the largest difference between poor and rich countries of any health indicator. So at the level of preconception and prenatal care, pregnancy complications and childbirth are the leading causes of death among women of reproductive age. So less than 1% of these deaths occur in developed countries, showing that they could be avoided if resources and services were available. So for maternal and child health, there are birth-related disabilities that affect many more women and go untreated, like injuries to pelvic muscles, organs, or the spinal cord. So at least 20% of the burden of disease in children below the age of 5 is related to poor maternal health and nutrition, as well as quality of care at delivery and during the newborn period. 8 million babies die before or during delivery or in the first week of life. And furthermore, many children are tragically left motherless each year because of the increase in maternal mortality. So, these motherless children are 10 times more likely to die within 2 years of their mother's death. Such that maternal and child health and disease has multi-factor origins and can exist of sequential and continuous form. So bad maternal conditions account for the fourth leading cause of death for women after HIV, malaria, and tuberculosis. So maternal death is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. So the burden of maternal mortality is an important input to health decision making. The Global Burden of Disease in Pregnancy, Women analysis provides a comprehensive and comparable assessment of mortality and loss of health due to pregnancy and its risk factors in all regions. It is assessed using the disability adjusted life year that combines years of life lost due to premature mortality. Maternal death is to facilitate the identification of maternal deaths in circumstances in which cause of death attribution is inadequate. A new category has been introduced. So, pregnancy-related death is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the cause of death. So, this is the maternal mortality ratio 2015 with green showing minimum target reach and the red which means shows that it's more than 420,000. Orange would be the middle ground. You could see India in the Philippines in the yellow-orange spectrum, and you see the red maternal mortality being Africa having the most problem with maternal mortality. It is a critical indicator of population health reflecting the overall state of maternal health as well as quality and accessibility of primary health care available to pregnant women and infants. Maternal mortality ratio is measured per 100,000 live births. So measuring the maternal mortality accurately is difficult except where comprehensive registration of deaths and of causes of death exists. Maternal deaths are clustered around the intrapartum. The most common direct cause globally is obstetric hemorrhage. Other major causes are anemia, sepsis, obstruction of labor, hypertensive disorders, and unsafe abortions. It is affected by many factors like frequency and spacing of births, nutritional level, stature, and maternal age. Risk would be appropriate medical and midwife support, access to emergency and intensive treatment if necessary, lack of management capacity in the health system, and the lack of political will and lack of management capacity in the health system. Another risk to expectant women is malaria. It can lead to anemia, which increases the risk for maternal and infant mortality and developmental problems for babies. A majority of these deaths and disabilities are preventable, being mainly due to insufficient care during pregnancy and delivery. Another threat is HIV infection. So mother-to-child transmission of HIV continues to be a major problem, with up to 45% of HIV-infected mothers transmitting infection to their children. Furthermore, HIV is becoming a major cause of maternal mortality in highly affected countries in southern Africa, especially with the TB reemergence. And closely tied to maternal health would be children's health. So child's health includes physical, mental, and social well-being of the child. Each year, more than 10 million children under the age of 5 die, and at least 6.6 million child deaths are preventable if affordable health interventions are made available to the mothers and children who need them. So what are these underlying causes of child illness and death? So poverty, more than 200 million children under 5 live in absolute poverty, living on less than $1 per day. Undernutrition and malnutrition, 200 million children under 5 are malnourished, and high fertility and short birth intervals. A critical indicator of population health reflecting the overall state of maternal health as well as quality and accessibility of primary health care available to pregnant women and infants is infant mortality. This is defined as the number of infant deaths per 1,000 live births in a population. Other indicators would be your neonatal death. This is death of an infant less than 28 days after birth. Post-neonatal death. This is death of an infant between 28 days and 1 year after birth. And low birth weight. So birth weight less than 2,500 grams and very low birth weight 1,500 grams. So this IMR is made up of two components. Neonatal mortality, first 28 days of life, and post-neonatal mortality, 29th day but within the first year. So the leading causes of neonatal death include birth defects, disorders related to short gestation and low birth weight, and pregnancy complications. The most preventable are those related to preterm birth and low birth weight, which represent approximately 20% of neonatal deaths. Post-neonatal death reflect events experienced in infancy, including SIDS, birth defects, injuries, and homicide. SIDS is the leading cause of post-neonatal death. Most neonatal deaths usually occur in the first 24 hours of life, and 3/4 of neonatal deaths occur in the first week after birth. Most newborn deaths are preventable through affordable interventions. To address the high burden of newborn deaths, care must be available during pregnancy, labor, and postpartum. Health of infants depends in large part on their health in utero. A fetus with severe defects or growth problems may not be delivered alive. Because only live births are counted in infant mortality rates, perinatal and fetal mortality rates provide a more complete picture of perinatal health than does the infant mortality rate alone. Perinatal mortality is defined as deaths of live-born infants through the first 7 days of life and fetal deaths after 28 weeks of gestation. This rate is a useful overall measure of perinatal health and the quality of health care provided to pregnant women and newborns. Fetal death often is associated with maternal complications of pregnancy, such as problems with amniotic fluid levels and blood disorders. Also, when birth defects such as anencephaly, radial agenesis, and hydrocephalus are present. The rates of fetal mortality are 35% greater than average in women who use tobacco during pregnancy and 77% higher in women who drink alcohol. Targeting prenatal risk screening and intervention to high-risk groups is critical to reducing this gap. So for stillbirth, information about 4 million neonatal deaths worldwide is limited. Even less information is available for stillbirths, babies born dead in the last 12 weeks of pregnancy, and there are no systematic global estimates. The numbers of stillbirths are high in regions in which most stillbirths occur, with underreporting being a major challenge. under 5 mortality rate indicates the probability of dying between birth and exactly 5 years of age expressed per 1,000 live births, if subject to current mortality rates. It has several advantages as a barometer of child well-being in general and child health in particular. It measures an outcome of the development process. It is known to be the result of a wide variety of inputs. So nutritional status and the health knowledge of mothers, level of immunization and oral rehydration therapy, available of maternal and child health services, which include prenatal care. Income and food availability in the family affects under 5 mortality rate, availability of safe drinking water and basic sanitation, and safety of the child's environment, among other factors. Under 5 mortality rate is less susceptible to the fallacy too, that is a picture of the health status of the majority of children and of society as a whole. So for children less than 5 years mortality, globally 80% of all child deaths to children under 5 are due to only a handful of causes, with pneumonia being on top of the list and diarrhea, followed by malaria, sepsis, preterm delivery, asphyxia, measles, and HIV. Others would have multiple causes such as acute infections, immunocompromise and undernutrition, perinatal dysfunction due to multiple anomalies, and other physiopathologies. And relating this to the SDGs, it aims to reduce global maternal mortality rates to less than 70 per 100,000 live births. It aims to end preventable deaths of newborns and children under 5, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortality rate to at least as low as 25 per 1,000 live births. This is to ensure universal access to sexual and reproductive health care services and its integration into national strategies and programs. Because these are simply the facts. 17,000 fewer children die each day than in 1990, but 6 million still die before their fifth birthday each year. Measles vaccines have averted 15.6 million deaths, and 4 out of 5 deaths would occur in Saharan Africa and Southeast Asia. Children in poverty are twice likely to die, and children with educated mothers more likely to survive. Although maternal mortality has fallen by almost 50% by 1990, two-thirds in East Asia, North Africa, and South Asia. Maternal mortality in developing countries is still 14 times than that of developing regions. 65% more women are receiving antenatal care, although half in developing countries receive adequate health care. So there are fewer teen pregnancies, but decreased has plateaued. The need for family planning is slowly being met. So what are the emerging and re-emerging problems to maternal and child health? You have AIDS, multi-resistant TB, dengue, viral fever, old diseases, new burden, cholera, avian and swine flu. Well, we could add coronavirus to that, conflicts, war, and infrastructure destruction, bad governance, and ineffective policies. Prevention, mainly still vaccination, folic acid supplementation, tetanus toxoid vaccination, screening for syphilis, hepatitis, preeclampsia and eclampsia prevention, that's calcium supplementation, and intermittent presumptive treatment for malaria in pregnancy. Antibiotics for premature rupture of membranes. You manage breech, labor surveillance, clean delivery practices, breastfeeding. You prevent and manage hypothermia, kangaroo mother care, newborn temperature management, insecticide-treated materials, and complementary. So you have your zinc, HIV vaccine, water sanitation, antenatal steroids, vitamin A, nevirapine and replacement feeding to prevent HIV transmission, your measles vaccine, detect bacteriuria, corticosteroids for preterm labor, newborn resuscitation, community-based pneumonia case management, and oral rehydration therapy. So antibiotics for diarrhea, sepsis, antimalarials, vitamin A in respiratory diseases. So remember our concept map to reduce maternal and mortality and child mortality. We have a lot of things to do because maternal and child mortality has a lot of causes and affected by a lot of factors. So we need the holistic approach. Thank you for listening to our preventive medicine and community health lecture. Subscribe to our channel for more lectures on preventive medicine and community health. Thank you.